research on the social and physical environmental factors that contribute to health and health inequity. Her work has appeared in many journals, the American Journal of Public Health, Social Science and Medicine, and more. Dr. Schultz has partnered with local community-based organizations and Mrs. Reyes as well, who unfortunately won't be able to make it today due to personal reasons, but both have worked in the organization that's titled Community Action to Promote Healthy Environments in an attempt to adopt a solution-based approach to determine the potential for public health action plans as a method for reducing air pollution and promoting health equity in Detroit. So with that said, I'd like to thank Dr. Schultz for showing up and being here today. It's an honor to have you here with us, and I'm very excited.
Thank you so much, Samuel. And thanks everyone for having me. I'm very much looking forward to talking and thinking with this group today and sharing some of our work from Detroit, tackling the issue of air pollution, which is a challenge that confronts a number of communities across the country. And so I'll be talking about it from our particular perspective and our particular experience in the Detroit area, and excited to share it with you and hear from your own experiences. I also want to thank Samuel for recognizing Angela Reyes. Angie is a long-standing friend and colleague. She's the executive director of Detroit Hispanic Development Corporation and has worked with us for over actually 20 years on the work that I'm going to be sharing today. She wanted me to send her regrets that she was unable to join the conversation today. She was really looking forward to it, and due to circumstances beyond her control is not able to be here. Okay, so I think I'm going to start sharing my screen. And I am going to ask if people have questions, feel free to go ahead and pop them into the chat as we go along. It would be helpful if someone could help me to monitor those, because I may miss some of them as I'm paying attention to the slides and that sort of thing. So the title of our talk today is Community Action to Promote Healthy Environments. That's the name of our partnership. And I'm just going to minimize a few things on my screen here so that I can see better. And the focus of this partnership is on improving air quality in the city of Detroit. We've been working together formally as a partnership for about 8 years now, but many of the partners involved with this work have a history of working together for about the last 20 years or so. I wanted to start by just inviting those of you who are on the call to think a little bit about, actually I want to start with a land acknowledgement. I am talking today from the University of Michigan. We are located on land that was ceded for the purpose of creating the University of Michigan. It was ceded by the Anishinaabe, the Potawatomi, the Odawa, and the Seneca, and the Delaware, and the Shawnee, and the Wyandot nations. So multiple nations who ceded land for the purpose of creating the University of Michigan. I want to just recognize that the histories of genocide and settler colonialism that have underlie our country and that underlay the giving of the land to the University of Michigan, and hope that by recognizing the foundations that underlie our work today and our ability to come together today, we can create a foundation for applying our research, our teaching, and our practice to creating a more just and equitable future. And so I wanted to start this conversation by just inviting those of you who are here to maybe pop into the chat a couple of thoughts or responses, reactions to the term environmental racism. What does that term mean to you? Is it something that you've run across in your previously in your work? And maybe we'll just take a moment and allow folks to pop a few thoughts in about that term. If it's something you haven't come across before, that's fine too. Okay. Disproportionate environmental impact based on race. Great. Result of redlining. Absolutely. Redlining meaning banking processes which determine which communities could get mortgages or home loans. Lead poisoning prevalence in minority communities. Absolutely. Couple of people thinking about this in regard to pollution, access to parks. Great. Okay. Thanks, folks, for chiming in. And those who haven't, if you feel so inclined, feel free to continue to add. The definition of environmental racism that I will be working from today is that it is the disproportionate impact of environmental hazards and multiple environmental hazards on people of color. Environmental justice is a response of the environmental justice movement to environmental racism, which took the forms, has taken multiple forms, some of which you guys noted, redlining and that sort of thing in the chat. Environmental justice then, sorry, I'm having a little bit of trouble advancing my slide. There we go. Environmental justice is the movement's response to decades of histories of environmental racism, and it means the fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and procedures. This is a definition that's been operationalized by the EPA, the U.S. Environmental Protection Agency, in their work. And I want to call attention in particular to this second part of this phrase, which is the meaningful involvement of all people in the development, implementation, and enforcement of environmental laws. Often we think of things like environmental justice in terms of the outcomes. Do we have a just outcome in terms of equitable exposures or similar exposures of different racial ethnic? This work is absolutely important to thinking about environmental justice, and it basically signifies that everyone should be meaningfully involved in making decisions that affect the kinds of environmental hazards that they are exposed to. And that's a lot of what I'll be talking about today, is processes for meaningful engagement and collaborative work towards the end of equitable outcomes. So just a little bit of history before I dive into talking about our partnership about air quality in Michigan, and in particular in Detroit. So Detroit has a history as a manufacturing city. It has a lot of industrial uses within the city, and has struggled with air quality for decades, in part as a result of that manufacturing and industrial history. There are multiple pollutant sources in the city of Detroit, and those are what we sometimes call stationary pollutants, so things that are fixed in place, industrial sources that emit pollutants. We are the motor city, so we also have a number of freeways that come through the city, and diesel truck and other traffic that emits pollutants that go into the air and contribute to the mix in an important way, the mix of air pollution that residents of the city are exposed to. We also have a large population in the city, and many of the land uses that emit pollutants are very close to residential areas, homes, schools. This is a playground in Delray, which is in the southwest corner of Detroit. And you can see behind it is an industrial land use that emits a substantial amount of air pollutants. And so these are some of the challenges around air quality in the city of Detroit. I'm going to talk a little bit more about those in just a moment. But before I do, I also want to just recognize that Detroit is an incredibly culturally rich community. It's incredibly diverse. Detroit now is about 80% non-Hispanic Black. It's about somewhere in the ballpark of 10 to 12% Latinx, and the remaining 10%-ish is a mix of non-Hispanic white residents, Bengali, and a number of other communities that come together to make up a very rich community within the city of Detroit. It has among its assets and resources are residents that are absolutely committed to the community and to their neighbors and to making Detroit a healthy place, a strong community with strong social relationships. And Detroit has a long history of advocacy and organizing mobilization around issues of social justice. It was a very strong player in the civil rights movement in the 60s. It has been a source of environmental activism since the 1980s. And continues to be a place with very strong environmental leadership from within the community. So I want to recognize that there are many assets and many strengths within the community at the same time that it is a community that continues to experience a large number of exposures to environmental toxicants. So this is 48217 is often talked about as one of the most polluted neighborhoods in Michigan. It's the home of a Marathon oil refinery, which you can see in this photo, and you can see a little bit of how close it is to a residential neighborhood with a home right there along the fence line to the Marathon oil refinery. The refinery has continued to expand over the last several decades, and most recently it expanded its capacity to refine dirty tar sands dilbit from Alberta, Canada. That's diluted bitumen, which is a very dirty, it's a sand that's embedded with oil, and it gets shipped to Detroit, Michigan from Alberta, Canada to be refined and then shipped elsewhere then to be burned to many other places. But the refining actually takes place near residential neighborhoods right in the city of Detroit. And you can see from this photo, there are a number of emissions that come from that. It also is the home of the US Steel and 4 DTE, Detroit Energy coal-fired power plants, which produce a fair number of the power for the area. The sulfur dioxide, which is one of the major emissions that comes from coal-fired power plants, is of concern in the city of Detroit. It exceeds the federally allowed limits of SO2, and it's implicated pretty substantially in the development of childhood asthma and also exacerbations of childhood asthma. And here you can see again some homes in the Delray neighborhood that are proximate to Zug Island, which is a major refinery and pollution source. And this is just another example of some of the challenges around air pollution that are faced within the city. This is a metal and scrap yard that is immediately proximate to a neighborhood in Southwest Detroit. And then coming back to this photo, which I showed earlier, this is the Delray playground. It's next to a wastewater treatment plant, the incinerators that incinerate waste from wastewater treatment. This treatment plant is located in a fairly high poverty neighborhood in the city's southwest area. And it processes sewage from about 1/3 of Michigan's population. So sewage is shipped here from many places in the state where it's then processed and the sludge is burned here. And you can see the children in this neighborhood on this playground are very close to the emissions from that. So those are some of the challenges around air quality that Detroit faces. Our partnership, the Community Action to Promote Healthy Environments Partnership, came together in 2014. So this is about our 7th or 8th year of working together. And we came together around the goal, the objective of addressing some of these challenges related to air pollution towards the end of creating more equitable health outcomes. Our ultimate goal is to improve health in the city. Before I go on and talk a little bit about community action to promote healthy environments, I want to do another little question for you guys and just get a sense for your exposure to the term community-based participatory research to see, what does the term participatory research mean to you? Have you heard about it? What do you know about it? So go ahead and again, and just pop your thoughts into the chat. And again, if you haven't ever heard about it, just feel free to let me know that. Okay, citizen science, somebody who's not sure. Okay, perfect. Taking the perspective of community members into account, integration within communities, learning inside out about the needs of others, not assuming that you know them, working with the public to understand and solve local problems, and somebody who hasn't heard of it. Perfect. All right. I am going to talk a little bit about how we think about this term and how we use it in the work that we do. I'm going to come back here. Before I do, I just want to introduce, these are the logos from all of the partners who are part of the Community Action to Promote Healthy Environments Partnership. There are a number of community-based organizations that are located in the community and led by local community residents who are part of our group. Detroit Hispanic Development Corporation, Angie's Shop is one of those, the Green Door Initiative. We also have representation from the community organizing environmental justice arm of the Sierra Club, their local branch, which is located in Detroit. We have around the table the Michigan Department of Environment, Great Lakes and Energy, which is the government entity at the state level that issues permits for air pollution or polluting industries in the city of Detroit, the local health department, and you can get a sense of the other key players. And I just want to recognize that they are absolutely part and parcel of the work that I'm presenting about today. So CAFE is a community-based participatory research partnership, and what we mean by that is that we work we attempt to work in an equitable manner that engages all of those entities that I just showed on the previous slide in working together to prioritize issues around air pollution within the city and to implement strategies to address it or to reduce it. And a lot of our work really is thinking about, are we working equitably? Are we actually addressing embedded social inequities, power dynamics that we know come along with our identities, that come along with our social positions in different agencies or organizations that have deeply embedded in the types of resources we all have access to. And a part of our work within the partnership is to think about the extent to which we are actually engaging those in a manner that allows all of the members of the partnership to contribute their ideas, their priorities, and their insights into the work that we move forward. Ultimately, our goal in this project has been to develop a multi-level, scientifically informed public health action plan, a lot of jargon there, I'll unpack it in a second, to reduce air pollution and adverse health effects. So by multi-level, we mean that we're not only focusing on for example, federal level policy, but we're thinking about federal policy, state policy, municipal policy, and we're also thinking very hard about actions that community residents, community organizations, or municipal leadership can take to address air quality. It's a deeply embedded problem within the city of Detroit. There are multiple levers that can be pushed to address it, and we want to think across all of those. And again, ultimately, our goal is to think about how do we address adverse health effects. And then our second objective is to actually implement components of the plan. We recognize that as a partnership, we're not able to do everything. And there's also many, many players in the city of Detroit who are working very effectively around these issues. And so part of our goal has been to identify those that we're well positioned to address and that others are not tackling. And I'm going to talk about those in just a moment. So community-based participatory research is the type of participatory research that we think about or talk about within our partnership. We strive, as I a moment ago, for equity, both in our process and in our outcomes. So are we working together equitably as partners and making sure that everybody is able to contribute to the ultimate goal of addressing air pollution and health. And we also have very much a strengths-based focus. So I did just talk about a number of the challenges within the city of Detroit, but we feel very committed to the idea that in order to address those challenges, we need to be identifying the strengths that exist within the community and finding ways to amplify those and bring them to bear on the challenges around air pollution. Our central aim is to increase knowledge about factors influencing exposure to air pollution and health among policymakers, among local residents, and then to translate that knowledge into action to create change around air pollution, and specifically around the Public Health Action Plan we've developed, which I'll talk about in a second. And we hope to implement an innovative policy and practice solutions to reduce pollution exposure and mitigate adverse health effects and evaluate the process and impact. So a couple of things, I'm going to share just a few of the things that we've done together as a team. One of the early things that we did was we tried to get a handle on air pollution in the city, and we tried to think about what are the sources and what are the impacts. This is one example. We have been able to quantify that each year in the Detroit metropolitan area, air pollution is responsible for approximately 690 deaths, about 1,800 hospitalizations and emergency room visits, thousands of missed school and work days. When children go to school and there's poor air quality, they may have an asthma exacerbation, and they may need to go to the emergency department to get that addressed. Their parents may need to miss work in order to take them. So the total monetized cost of air pollution in the city of Detroit is about $6.9 billion per year. We have also mapped where those exposures and those impacts occur disproportionately. I'm going to show you a couple maps in just a moment, but may not be any surprise to those of you in this audience that these effects occur disproportionately in Detroit, which is a predominantly African American and Latino city, and in surrounding areas with high concentrations of poverty, African American and Latino residents. These are a couple of the maps that showcase this. The maps called County area, which is Wayne, Macomb, and Oakland County. The area that is shown, you can see it in the city of Detroit, and in the right-hand map, the city is outlined with a blue outline. And you can see the way both of these maps work is that darker colors, so the more red colors, are showing you the highest levels of exposure. And as we go down and more orange and more yellow, those are lower levels of exposure. The map on the left shows the levels of exposure at the census tract level to diesel PM, which is the kind of particulate matter that comes from diesel trucks, and as well as cancer and respiratory risk that is specifically able to be attributed to air pollution in the city of Detroit. So you can see how that clusters in the city of Detroit and in a couple of outlined areas, Pontiac, for example, which again is a predominantly African-American community where there are higher levels of exposure. The map on the right actually shows population characteristics. And so this is derived from census data. And it shows the concentrations of what gets called population vulnerability. And that means vulnerability to excess exposure to air pollution, but also susceptibility to more serious health effects of that air pollution. So it includes things like concentration of poverty, the percentage of households that are renters, the percentage of households where there is no adult over the age of 18 that speaks English as their first language, which is often used as an indicator of social isolation from, for example, information that might be coming from government sources. And markers of susceptibility include things like the proportion of the population that's under the age of 5, or the proportion of the population that's over the age of 60, because we know that very young children and older adults at any given level of air pollution are more likely to have more serious health effects from that exposure. So you can see that from the juxtaposition of these two maps that the areas with some of the highest levels of air pollution are also the areas with the highest concentrations of people who are most likely to be adversely affected. We wanted to create these kinds of maps in order to both inform our understanding of who's getting exposed, but also to prioritize our actions so that we could think about which communities most need relief from areas from exposure to air pollution, and think about equity as a central component of the issue that we're tackling. This next slide just takes those same two slides that we just looked at, they're shown here on the right, and it overlays it against the percentage of people of color. And we do this in order to just as another indicator of the extent to which this is a environmental injustice issue, and to illustrate the degree of environmental racism that is implicated in who's being exposed, and where those exposures are most concentrated in our work. We compiled all of this information into something that we call our CAFE resource manual. It has what I just shared with you and a lot of additional information, including models that our environmental health science counterpart ran, looking at the contributions to mortality, the contributions to asthma, but also modeling what if scenarios. So if we were able to close down the 4 coal-fired power plants that emit sulfur dioxide and contribute to asthma within the city, how much would we be able to see a reduction in asthma within the city? We did that in part so that we could quantify health benefits of different strategic actions that we could take to improve air quality in the city, and also so that we could put dollars and cents with those, so that we could say, if we reduce asthma by this amount, here are the cost savings in terms of reduce hospitalizations, reduce school time, reduce work time for parents. Could make a case, policy and decision makers, that it's worth it to invest in prevention, because there's a long-term health payoff for that. Okay, so once, I'm just going to take a quick look at the chat here and see if, okay, so Samuel, I'm seeing your comment there. It's definitely not subtle. So once we had developed all of this, the sort of science that was the foundation for the work that we wanted to do to reduce air pollution and to reduce the exposure of populations, we developed a set of recommendations primarily by looking at what other cities had done, cities that were comparable to Detroit, what they had done to reduce air pollution within their cities. And then we also looked at a set of other strategies that could be used. And this is our team. These are members of the partnership. And we did a lot of work within our partnership to try to think about what would our recommendations be for strategic action to reduce air pollution and improve health within the city. We did a lot of that work. We developed drafts of 25 recommendations that we thought were viable and able to be implemented in the space of Southeast Michigan and the city of Detroit. And then we took those recommendations out and had a number of conversations with broader community groups to get input, to get their insights about what would work, what wouldn't work. Where do we have the language wrong? How do we need to be thinking about this differently? And these are some photos from some of the conversations that we had with community groups who really helped us refine the recommendation, and had a lot of input into what we needed to change from our first pass, and how to modify them to make them more reasonable to implement within the space of the city of Detroit. They also helped us think about key decision makers and who we needed to be getting the information out to in order for it to influence policy. This is a quick picture of our press release where we launched the Public Health Action Plan. You can see our plan on the right. It's also available at on our website, with the link is shown there. And in the Public Health Action Plan, we had 25 evidence-based recommendations for things that we think are viable and not hard to do within the city of Detroit in order to reduce pollution that's coming from different sources. So point source pollution, so that's things like the plants that I showed the pictures of, those are called point sources. Mobile sources, which would be more pollution that's coming from freeways and trucks coming in through the city, and other types of strategies that can be used. We included in the Public Health Action Plan not only the strategies, but very explicit, as explicit as we could be, about what would need to happen in order to make this happen, and who would be the key decision makers that would need to be involved in that process, because we really wanted it to be a tool that could guide action for change. Since we've launched that plan, we've been working really hard to implement components of it. We regularly use it as a foundation to inform policymakers. So this is just a little snippet from one of our policy briefs that we've created on diesel PM exposure, population mortality, or sorry, population vulnerability and mortality. And we use this to share, to talk with policy and decision makers about why this is an important issue, and why we need to be focusing in particular on communities with high levels of cumulative risk, right? So both high levels of exposure and very vulnerable populations. We also use it to comment regularly on proposals that industry, for example, might put forward that would allow them to increase emissions or change the emissions that they're putting into the air as a result of their industrial processes. So this again is a snippet from a comment that we made on the Marathon Oil Refinery, was proposing some changes, some modifications in their practices, and we provided some in-depth comments from our the science that we had done early on in our project about the implications of what they were proposing, and that also offered a number of recommendations for ways that they could modify what they were proposing to do to be more protective of public health. And we do this on a pretty regular basis because there's a lot of permits that come down. We also work really actively with policymakers. We do trainings for community residents around policy advocacy. Those are always done in partnership. So I might be part of it, and then part of my team would be one or more of our community partners who do these together, because our community partners, first of all, are incredibly sophisticated about policy change and how to make it happen. And I know a little bit and can talk a little bit about it, but I think by by presenting together and working together to do these trainings, we have a much richer conversation around policy. We do power mapping, so we train groups in how to do power mapping, which is a community organizing tool that's used to identify who is the decision maker and how might we think about information to them and shaping the decisions that they're making around air quality issues. I want to talk in depth about, a little bit more depth about a couple of the other activities that we've been involved with. So one of the big challenges in the city of Detroit is that we have a lot of big diesel trucks that travel down residential streets in the neighborhoods, and they're therefore exposing neighborhood residents to high levels of particulate matter from those diesel trucks. This project is actually led by Detroit Hispanic Development Corporation, which is one of the partners within one of the community-based organization partners as part of our partnership. And they're working to do a number of things to both document trucks on residential streets. So they're putting cameras up in areas where there are lots of trucks that are moving down residential streets. They're also putting noise sensors out so that they can document the high volumes of noise that come from some of the trucks. And some of you may know that there's a growing body of evidence that high levels of noise actually contribute to adverse health outcomes like cardiovascular disease. So they're trying to document that. And we're working very actively with members of the Detroit City Council to draft an ordinance that would have more teeth in it than the current ordinance for trucks that just park on a city street, maybe in somebody's house, and sit there and idle for long periods of time, which creates spikes in diesel particulate matter And when that happens on a residential street, the people who live, where that truck is idling are exposed to high levels of diesel particulate. We're mounting, our community partners in particular are taking leadership in mounting an anti-idling campaign to move that forward. This map, I'll just share briefly, but it shows there have been some work in the city where they're recommending new truck routes. And this is kind of the southeast corner of the city of Detroit, which is where this work is happening. The purple routes are going to be residential. They're going to be recommended as truck routes. And what we did, which the recommendations had not done, but we took and we overlaid the map of recommended truck routes on a map that shows residential land use. So if you see the blue, the kind of turquoisey blue areas, those are residential neighborhoods where people live, they raise their kids, they have their pets. And what you can see in this map is that many of these recommended truck routes travel straight through highly residential areas, which we're quite concerned about because it means that people living in those residential areas are going to have high volumes of these trucks traveling up and down their streets with the known health implications of that. So we're working to both document this, and we're also working with a number of community groups to try to identify alternative truck routes that we would recommend that would not be traveling through residential neighborhoods. A second thing that we've been working on since we published our public health action plan is a health impact assessment of the Gordy Howe International Bridge. You may or may not know that Detroit is actually the location of the Ambassador Bridge right now, which is the largest trucking route for truck traffic that's shipping things between Canada and the United States. So we're immediately across the Detroit River from Windsor, Canada. About 15,000 trucks a day go across the Ambassador Bridge. This photo shows a little bit of a snippet of how close the freeway that goes to the bridge is to residential neighborhoods in the city. And this is of high concern for all the reasons that I've already talked about. And the Gordy Howe International Bridge is a second bridge that's in the process of being built right in this same neighborhood. And the concern of neighborhood residents is it's going to bring even more trucking, more truck traffic, and other adverse health effects into the area of the city. And so they have organized, they call themselves the Southwest Detroit Community Benefits Coalition, and they have been organizing around this for about the last decade. They asked our team to come in and do a scientifically grounded health impact assessment that would try to understand what are the likely health impacts of this new bridge that's being created in Detroit. And you can see this is one of the maps that we showed earlier that shows the existing levels of air pollution in the city and health risk associated with air pollution. The black arrow in the center of this diagram points to a little green area. That is the area where they're proposing to put in the new Gordy Howe International Bridge. And you can see it's in an area that is already heavily impacted by air pollution. So that's part of the concern. So the community group asked us to do a health impact assessment. I'm going to share just really quickly a couple of the findings that we had. We found that people who lived in this area, who lived within 500 feet of I-75, which is the freeway that I just showed the picture of, or streets with heavy truck traffic, reported significantly higher rates of asthma compared to those who were living more than 500 feet away. And this is before the bridge is built. So this is before the increased volume of truck traffic that's being expected as a result of that. And this finding was held after accounting for gender, age, and smoking. So we feel pretty comfortable in saying that's attributable to being close to all those trucks traveling up and down the freeway. The percentage of children living within 500 feet of the freeways that have asthma is about 19%. Just for comparison, the national percent of children within that same age group is about 8%. So it's substantially higher. We also found that about 67% of people who lived right in this area where the bridge is being built said that noise at nighttime during sleeping hours was very much or something of a concern, and about 71% said noise during the day was very much or something of concern. And we think that this is attributable to the large volumes of trucks and heavy equipment that's in the area right now as they're building the bridge. As part of our health impact assessment, we made a number of very specific recommendations for ways that some of these adverse effects of the bridge as it's being built and also once it's operational could be reduced for neighborhood residents. So we suggested moving the trucking route so that they're not going through residential areas, requiring spatial buffers, which are buffers between a pollution source and where there are vulnerable populations, so not putting them right next to each other, installing vegetative buffers, which is planting trees and things which can capture both, they can reduce the noise and they can also reduce some of the pollution that finds its way from the freeway to where people are living. And building a wall is another way to reduce those some of the pollution that actually gets to people. So these are some of the asks that now are coming out that the Southwest Detroit Community Benefits Coalition is bringing to bear. They're using some of the data we were able to generate through the health impact assessment to ask for a number of accommodations that would reduce some of the adverse health effects for residents of the area as this bridge is being built. This is just a picture of what a buffer looks like for those of you who might want to see it. So where it says dirty air, you can see all the cars and things there that are emitting the dirty air. And then you have a vacant lot or some trees planted in between the sources of the dirty air and where people are living. And it can cut down on the amount of pollution that's reaching people. So it's a potential solution to some of the challenges here. Two more quick examples, and then I'm going to stop talking and we can have a little conversation about some of this work. One of the things that we're doing in the city of Detroit is we've actually just received a grant that will allow us to expand the air quality monitoring network in the area. So monitors are located in various ways around the city, and they provide information about air pollution at the point where the monitor is located. There are not enough monitors. There are many other places in the city where air pollution is a concern, but we don't have good information about that. So we are going to be adding to the network of air quality monitors within the city. What we're doing right now is we have a survey out, and you can see it's on our website. And the green box here is just what the little you can click to answer the survey, but anyone within the city of Detroit or anyone actually can go in, complete the survey, and they can drop a pin on the map that I've shown here and say, I'm really concerned about the air quality in my neighborhood, which is located here. And then that will all be input into helping us think about what are the places where we can add information that can be available to people. We'll be making a portal that will make the air quality data available to community residents in near real time. So they'll be able to see what their quality of air is in their neighborhood by just going to that web-based portal. And the last thing I just want to highlight from some of the work that we're doing right now is we're working really closely with the Detroit public school systems. There are a number of schools in Detroit that are located in some of those red areas that I showed on the map earlier. There's a lot of concern about the health of children who are attending those schools, who are exposed to high levels of the indoor air pollution and all of the health impacts and missed school days that we know are associated with that. We're going to be working with a number of schools to install indoor air filters that will be reducing the amount of air pollution within the schools. And we're going to be working with parents, youth, and teachers and administrators in that school to develop some science-based stem cell protocols, so students will be able to use the air quality filters and monitors to develop science, technology, engineering, and math skills. And then also we'll be working with them to do some advocacy with policymakers about the importance of filtering indoor air quality in neighborhoods where there are high levels of pollution. I think that's it. Yep. So I just wanted to just close by saying that by working together in participatory manner, researchers and community members can create opportunities for all partners to work together, and we can make use. We can conduct research that is useful and can be translated directly into to inform local, state, and federal policy, as well as local practices like whether there are air filters available in the indoor in schools. They provide resources to support action based on science and can be really critical to moving this work forward. We believe very strongly that community-based participatory research can be a tool for resistance and for liberation movements by bringing together science and action towards the end of public health. That's it. I just want to acknowledge again all the partners. And this last slide, feel free to reach out to me if you at any point, if you're interested in talking further about this work. So I'm going to stop sharing and open the floor for questions, discussion, conversation. I know it was a lot of talking at the end of a long day. You guys have already been on the Zoom call for a bit. So, and feel free to use the chat or to just chime in. Yes, I will show the last. How about, since that last slide was just my contact information, let me just pop it into the chat, and then it's easier for you guys to get it. So this has my email address, and it also has the cafe website if anybody wants to go there and look at any of the resources that I just shared. Yeah, so the really good question, do you have situations where different communities need different solutions? We both have different communities that have a need for different solutions, and we also have way more communities that have challenges with air quality than our partnership is able to address. So, so on the first point, Southwest Detroit, which is the site of the Gordy Howe Bridge and some of the other challenges that I talked about, it has some of the highest levels of air pollution in the city, and that air pollution comes from both stationary sources, because where the coal-fired power plants are that produce sulfur dioxide and other sources, they're located upwind. So those communities are downwind. So the wind pushes the pollution into Southwest Detroit communities from those stationary sources of pollutants, and the major freeways that are coming to the bridge that goes to Canada also travel right through those communities. So they have really high levels of pollution from both point sources and from freeways or mobile sources. There are other parts of the city where primarily the sources of pollution maybe are from point sources or from dust. If there's lots of trucking in the area and it's kicking up a lot of dust. So it's really important in doing this work to understand what are the sources of pollution, and in some cases, what are the specific pollutants that are being generated, because they have different health outcomes and they have different ways of containing them or controlling them. So yes, you have to kind of move into this with you can start with maps like the maps that I showed, but then you really have to drill down and understand what exactly is happening here. Who are the industries, who are the decision makers who have some power over influencing decisions, and who are the key decision makers and corporate entities that we really need to be thinking with, and then specifically, what are the solutions? A solution to mobile air pollution is a different thing than a solution to a point source of air pollution. So if that helps. And it's always a challenge because there are so many sources of pollution, and so many communities, even in the city of Detroit, that are experiencing it, that policy solutions are great because they can leverage policy that has broad impacts. If you're working with at a finer grain at a community level, then you really need to be thinking, it may have an impact for that local community and not beyond, if that makes sense. For those unable to move out of areas impacted by environmental hazards due to limited economic mobility, how can we help them? This is such an important question. The health impact assessment that we did around the Gordy Howe International Bridge and the Southwest Community Benefits Coalition that's been mobilizing in that area have really struggled with this. That is a very tight-knit community. People have lived there for a very long time. Many people live there, and their family and their friends and their extended social networks all live there. And as the bridge is being built, some people are being displaced because their homes are being bought out because they're right in the footprint of the bridge. Other people are not being bought out, but they're going to be experiencing really high levels of increased truck traffic and noise and vibration. Actually, the trucks actually vibrate people's houses and can do damage to their foundations as a result of the more truck traffic. So one of the things that the Community Benefits Coalition has done is to organize and get a variety of options to be available to residents. So they've gotten agreement from the city to allow people who want to leave the area because they just don't want to live next to all of this new industry that's coming in, to be able to swap their homes. Because of course, as all this industry comes into the area, people's home values are just plummeting, right? Nobody wants to buy a house that's next to a big shipping corridor. So it's really hard for people to sell their homes and then buy a comparable home someplace else because they just can't get the money that they've invested in their homes out of it. So the Southwest Detroit Community Benefits Coalition has negotiated with the city to allow people who want to leave the area to swap their homes and to be able to get a comparable home in another part of the city that is owned by the city's land bank, and participate in what they call this home swap program. For people who don't want to leave, who really say, I love this neighborhood, and there are many people who do, I love this neighborhood, I don't want to leave my friends and family, there is also an opportunity, a very limited opportunity, for people to participate in a city supported process where they can get, for example, new windows that are tighter, right? A lot of the homes in this area are older homes, right? So they may have a lot of ability for outdoor air to come in with and carry pollution with it around the door frames or around the windows because they're not sealed really tightly. So this program would allow them to get new windows, new doors, to get their homes to be sealed better, to put soundproofing in their walls so that when the trucks are going up and down in front of their house, it's not creating quite as much sound inside the city or inside their homes. So the Community Benefits Coalition has used a lot of the data that has been able to be generated to argue for some of these benefits. So those are some of the things that they're attempting to do. Now, whether that adequately compensates people for the added exposure to pollutants and noise and having trucks, on their streets is another question. I think not, but the effort is to sort of mitigate some of the adverse impacts of it. What else? Saw a couple other questions here. So Margot asks, have you all conducted any research that reflects impacts these issues may have in regards to the pandemic? We have not directly. There is some really interesting work that has been done that suggests that areas with higher levels of air pollution that may be more susceptible to COVID-19. Some of that came out of Italy, where there are areas of Italy, if folks remember, as the pandemic was beginning to unfold, industrial areas of Italy were very heavily impacted by COVID, and people seem to, not only it spread really fast, but also people, there were very high mortality rates associated with it. And there was some research that was done in that space that was suggesting a link to, because the industrial areas had higher levels of air pollution, they were suggesting links to that higher levels of air pollution. There's been a little bit of that that's been replicated in the United States. We have not been involved in any of that directly, but some of it, there have been some suggestions that there are links to high levels of pollutants. All right, I see it's 5:30 and Samuel's getting you guys to do the evaluation. So any last questions before we close? All right.
In that case, thank you so much, Dr. Schultz. I truly appreciate your time, your knowledge and your experience that you've brought with you today. I know I've learned a lot, and this potential for this evidence-based approach is something that I hope we can continue out, not just within Detroit, but outside in other major cities as well, to fight this effect of this health inequity. That said, thank you all for coming. I truly do appreciate it. We do have one more session next week. That isn't as part of the speaker series per se. We don't have someone speaking, but it's a service fair that we do recommend everyone coming to. It's a great way for you to be able to learn about the different nonprofits and RSOs at USC that are going to be sharing the work that they're doing, and perhaps it'll be an opportunity for you to participate in that work if perhaps it interests you. That said, please fill out the evaluation form. We will send out a summarizing email within the next couple of days, and have a wonderful rest of your weekend. And once again, Dr. Schultz, thank you so much for your time, and we really do appreciate it.